So breastfeeding is a very important topic, but not for the reasons that I thought when I first went into this field. So we'll talk a little bit about medication exposure and breastfeeding, but where the really I think sort of bulk of the clinical experience with this is that breastfeeding is a very complicated issue for a lot of women. So women now get a lot of pressure, social pressure to breastfeed. Now, let me just preface this and say that from a nutritional standpoint, I'm not here to argue. Breastfeeding is best. We got that. And the public health message is out there, but what we have to remember is that the public health message doesn't necessarily pertain to each and every patient on an individual basis. So, breastfeeding is often very difficult, which is why we have a whole class of healthcare providers, lactation consultants, because it is often very difficult. And for many women, there can be this sort of bi-directional relationship between depression and anxiety in the postpartum and difficulty with breastfeeding. Sometimes there are trouble with supply. There are like sleep issues that go hand in hand with this. How many of you have children? Okay. So most of you have children. So in case you've blocked it out, newborn babies need to eat every 1 or 2 hours, maybe every 3 hours if you're lucky. And they don't just like eat quickly and go back to bed. Like that's not how it works. So like it takes a while to feed them, and then they're up for a while, and then they go back to bed. And so their little like life cycle is like, their day is like a 2 to 3 hour period, and it goes on like 24/7 for weeks in a row until later in the postpartum year when they're starting to put together some consolidated sleep. But for the first 2 or 3 months, the best a new parent can hope for is to be profoundly exhausted beyond their wildest dreams. Like it's just awful. Like it's so lucky that babies are cute because they're like need machines, right? So if a woman is exclusively breastfeeding from the breast, that means she is the only person that can feed that baby. And so now women are told, don't introduce a pacifier, don't introduce a bottle because the baby will get nipple confusion and won't be able to breastfeed. So I will tell you that if a woman has a serious psychiatric disorder, nipple confusion doesn't make her top 10 list of things that she should be worrying about. So if we're fortunate enough to work with someone during pregnancy, then we do consultation, bring in the partner, bring in the significant other. If there is no significant other, have the mom come in. But talk about who's going to help do some nighttime feeding so that the woman can put together some modestly consecutive sleep, so that, which can make all the difference sometimes between being well or being very ill. This pertains a lot in bipolar disorder, where sleep deprivation can worsen things. But I will say that just my clinical experience is that it takes 4 to 5 hours of sleep in a row to feel like a human being. And if women have depression or anxiety, part of the road to recovery from that is getting some consecutive sleep. So we really need to make sure that families are on board with that. And it's also, although it's a little bit heresy to say, it's okay not to breastfeed. It's totally okay not to breastfeed. So women often have to get that message from us that if they're giving it their best shot, and it's not working out. I've seen more tears in my office on the topic of breastfeeding than any other topic. And sometimes, like with all the authority that we can, kind of give to any other topic, is to tell people you need to stop breastfeeding. You gave it the shot, you're doing, terribly now around this topic, you need to stop breastfeeding. It's not usually a medication issue. With most of the medications, which we'll talk about, like it's reasonable to breastfeed, that's not the issue. But the issue is that, women often drive themselves into the ground and they feel so guilty if they're not breastfeeding because they're getting this message from everywhere, like breastfeed, 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 keep trying. And very often, nobody tells them that it's actually okay. Like, babies can receive some formula and live to tell.